My role in the healthcare industry is I work as a medical assistant in an ophthalmology office, so an eye doctor, and I basically just talk to patients, take their histories, and run basic visual tests on them. So I think it's important that I'm getting vaccinated just for my own health and the health of my family, and I want to, protect the health of the community.
My name is Sultan Chaudhry. I am a dentist. I practice here in Fairfax County. I also have an office in Loudoun County, and I teach at Howard University's dental school in DC. I think back in March, when many practices had to make the decision to scale back or to close and just try to wrap their minds around how to deal with coronavirus and how to continue to take in patients and to do what they do. We all were trying to understand the scale and scope of COVID. And, a lot of the world could stop, a lot of the world could pause to just kind of understand how to deal with this and what are the best practices. But for folks in emergency treatment, that wasn't an option. And so we tried to play catch up as much as we could. And my circumstance, I think a lot of healthcare providers share, where most of the members of the family are at home and isolated on a day-to-day basis. But then some members of the family, the ones that are actually in healthcare, the ones that are going and providing treatment, are not only exposed, they are hyper-exposed. They are in circumstances where they must remain very close to people that could be sick, that come in with illness, and we have to provide care to them. And so I think we owe it to ourselves and we owe it to our family members that are working so hard to follow all of the guidelines, to do everything in our power to help minimize the spread. Now, I know there's reservations about this vaccination. I know there's reservations about any sort of treatment modalities that are coming forward. But I think given everything that we know, this is the best path forward. And it is something that, as it becomes available, people should consider. Some practices are requiring it of their teams, some are not. For me, I think everybody needs to do their own research and make an informed decision that's right for themselves and their families. And I think if we all do that together, it'll help us get through this a lot faster.
So my role in the healthcare industry is that I am a school nurse at a private school here in Fairfax County. I have 20 years of experience being a hospital nurse and moved to school nursing 2 years ago. And so I'm here because I am still taking care of lots of little ones every day. They are why it is important for me to be vaccinated. I have close to 400 students plus faculty and staff that I take care of on a campus every day, Monday through Friday. It is the passion of my life. I love taking care of these people, and I am taking the vaccine to protect them. And I am taking it to show them that this is where we need to be as a community. We need to embrace this. We need to continue wearing our mask. We need to do our social distancing, but we need to get the vaccine and try and get this pandemic under control.